and blood, every breath of our life.
In a state where maternal health care was once considered as a privilege for a few, a beacon of hope has emerged. In September 2023, Governor Soludo CFR announced free antenatal care and delivery services in Anambra State for all the women resident in the state. This visionary initiative is transforming lives and ensuring that mothers do not have to choose between healthcare and their finances. We gladly welcome you to this episode of Solution Footprints, where we'll be taking you on a journey on the impact of Governor Soludo's visionary initiative on the lives of women in Anambra State and how it is transforming their lives on a daily basis. My name is Chidimma Oranwa. Join us on this journey today. With the coming of Governor Soludo CFR, the healthcare sector in Anambra State has indeed undergone significant changes, driven by various administrative reforms and investments aimed at improving the health sector by the government of Professor Soludo. One of the strategic areas has been that of maternal and childbirth health. Though maternal and child mortality is a significant challenge, particularly in developing nations where healthcare services are often inaccessible and inadequate, Anambra State, under Governor Soludo, has been extremely lucky with the manner and ways his government has handled the issue headlong by bringing hope to millions of expectant mothers. Of course, this is in spite of the fact that the state government has been at the forefront of major efforts focusing on enhancing the quality, accessibility, and efficiency of primary health services across the state. Governor Soludo's approach to healthcare is not only people-focused, but has a priority to deliver quality primary healthcare to everyone in Anambra State.
There were many hospitals without doctors and medical staff when we assumed office, 19 of them. But we recruited over 300 professionals, doctors, pharmacists, consultants, nurses, and so on. And the other day I approved again 500 healthcare workers, given our primary healthcare centers. We want to make medical services already available for everybody, especially to the poorest of the poor.
In line with his manifesto to boost the state primary health care workforce to enhance effective service delivery, Governor Soludo employed 493 healthcare workers, which includes 300 nurses and midwives, 42 senior medical officers, 40 community health officers, 80 community health extension workers, 30 junior community health extension workers, and 1 pharmacist into the system. Also, in fulfillment of his promise to implement the minimum service packages and standards for primary health centers, PHCs, operating in the state, Governor Soludo is presently upgrading and rehabilitating primary health care centers in the 326 wards of the state, giving them a first lift, provision of pipe-borne water and solar-powered electricity. Many have been completed, while others are still ongoing. This is also in a frantic bid to establish a referral system that originates from the PHC to the secondary and then to the tertiary levels of care across the state. For example, the primary healthcare center Norfija was abandoned before Governor Soludo came. Its renovation is currently ongoing. The Financial Secretary of Norfija Progress Union recalled that the bad state of the road used to make it difficult for people to access the center, which is no longer the case.
Formerly, at the initial stage, this hospital is not like this. At least you can see these 2 buildings. This was rated by His Excellency, Professor Charles Soludo. Especially this road, since over 20 years ago, many people have been the governor of this Anambra State, and they have been promising to construct this road, because when this hospital built here, no road to enter. In rainy season like this, you can't see anywhere to pass, so nowhere to cross. It's only 1 year in this office, in his office, not up to 1 year itself. If you can see now, motor is moving normal, everywhere is clean, and nurses and doctors are here. We make announcements at the town, the whole villages, tell them that the hospital is now moving normal. So there's doctors, there's nurses, because if you come here before, there's no nurse. So for now, there's nurses here, doctors, so it will move global now. So we are very, very much appreciate. He did well, and we pray that he will continue his good work. So Charles Soludo is our next governor, coming 2025. And I pray that he will continue to go to second tenure, so that the many work that remains, he will finish it. God will guide him, rotate him. All what he needs in life, God will do it for him. We are very much appreciate in what he did for us.
We, on behalf of North Asia citizens, we want to first of all appreciate our able governor. He's a solution for all the wonderful works he's doing in Anambra State, especially in our community in North Asia here. Because we are seeing a massive transformation of all the whole things in our place. You can see the good road we're enjoying today, and so many works that is being carried in this facility. I want to use this opportunity to thank him. In view of that, we wanted to we want to assist in our own side as a town. That's why one of us, Mr. Linus Anugo, Chief Akajugo, has donated all these equipments here to our primary healthcare development authority here. And today we are officially presenting it and handing over to our ES.
Dr. Felicia Mbanosi is one of the newly recruited doctors posted to North Asia.
Since we started work, we started on June of this year. We've seen like every week, weekly basis, we've seen like 10 patients every week, taking deliveries. We've handled many emergencies, all because of the solution governor, Dr. Charles Soludo. We are showing the citizens of Olumba South, especially North Asia citizens, to start coming to this primary health care, because they now have qualified health workers, especially the doctors. So we can handle all cases now, unlike before, they have only community health extension workers.
A key aspect of Governor Soludo's manifesto is the maternal and child health. His primary healthcare agenda aims at reducing maternal and infant mortality rates by promoting safe delivery practices, increasing access to prenatal and postnatal care, as well as ensuring widespread immunization coverage.
The little challenges are people knowing that aside immunization, aside family planning, that the men can actually walk in and check their blood pressure. You know, Governor talked about knowing your numbers. When you know what are the numbers, your vital number, your blood pressure, your sugar level, you know these numbers, and then maintain your numbers when they are normal. Please, the men, we need you to come and assess your health services here. When you come, you'll be sure we'll tell you about how you can manage hypertension, blood pressure, diabetes, everything about your health. I mean, even prostate. Most men need to know the food to take, the drugs, and then drug and drug interaction. These are the things we just want men to know, that the health centers are not only for women, that men can also come and access care. When Mr. Governor came on board, he decided that he will give facelift to all the over 600 health facilities in phases. So the first phase is actually up now. You can walk into a health facility, you find solar-powered boreholes, 24 hours we have light. Walk in anytime you want to have delivery, there's light. I mean, people are coming to our places to charge their phones. So we're having clientele. Whomever is coming to interface with us, know what we're doing, health education, everything is happening in our health centers.
Governor Soludo, as a forward-thinking leader, kicked off free antenatal care and delivery services on 1st September 2023 with free drops to Anambra women and people living within and outside the state.
No matter the race, whether you're black or white or pink or yellow, as long as you're a woman, you enter facilities, you have free antenatal services, and then you have delivery. free delivery. And I can tell you our data has shot up from what it used to be. People are now having babies. Baby making is now, trending in Anambra. People cross their state and come to Anambra to take delivery because even cesarean sections are done free of charge. So, I mean, that's having our population on the increase per second. We record every day people. And then the beauty of it is that you're not paying any naira for your drugs. The drugs are given to you at your ANC clinics. At the point of delivery, you have your mama kits. Everything you need to deliver, they are in the park. So you just walk into the health center, you want to have your baby, you walk in there, deliver your baby, carry your baby home. Whether you have triplets, quadruplets, free of charge. Everything is free of charge.
By implication, ever since, expectant mothers now receive quality health care in Anambra State without worrying about unaffordable medical bills.
Part of his work was to revamp the health sector. He did a good work in the sense that he recruited doctors, both the junior doctors and consultants. One of the consultants that has been part of recruited to help to revamp the health sector in the state, to be able to provide optimal and efficient health care to our children, specifically in my own regard. He has done two critical things: manpower recruitment and infrastructure development. So with this, people now have more belief in the system. And there is more increase in flow of patients who are seeking health care services. People now have free delivery, antenatal delivery, and also relatively free under 5 treatments. It's a relief to every one of them. You have removed the burden of finance on them, so they are happy. And they are happy that the government is providing free services for them. These are things that they would have paid for at a very exorbitant cost in private settings. Now they're coming to this state-owned establishment and they're getting them free. Not just free, they're also getting quality services.
This initiative has come as a welcome news to many women in the state.
For women in Anambra State, Governor Soludo's initiative is not just a policy but a lifeline. With every antenatal visit to safe delivery and postnatal care, they are claiming their right to quality health care in the state, not just for themselves but also for their children. This is a testament to the power of a committed, intentional and compassionate leader. The story continues.
At the antenatal clinics, mothers are being educated on the importance of maternal health care. They are administered with tests and medications, counseled on good nutrition, among others. After the declaration of free antenatal care and delivery services, Anambra has recorded zero maternal and child mortality. For example, in May 2024, 1,144 mothers accessed the free delivery services. In June 2024, 1,050 were delivered of their babies, while in July of the year in review, 938 mothers smiled home with their babies, courtesy of the new state policy. Listen to Mrs. Chinwe Ozemena testify about the impact of the free antenatal care and delivery services.
Before Bonnet, they got buried antenatal. They do now go. Now I got a gay back at Nega back at the Edica 2000 more 25. A weba, a webia, a biazia, I was saying, no go naga tia in Ulogo, no go no muka, or Tabel, where no go 3,000 more 2,000 now. A webia, now, we get you when made a women and I move you do well more. A mole go on awful. You were better well webia and name Muanga. They move down wow, yeah, they go get their pally. A bolle 30, a bolle 40. My joy is saying, man can order for man now or the one eager missing. Man and can have no woozy, no bataba, a long way. I said when I'm trying to log on a balantinenta. Nene Chayara, and your free, never. But we got Mukum, but I will move 1 way in a rink and Muchaqua, to Quelling way and never. No one to Bob on a Kachinek and William Ellen was having. Would you Pelaka would ya to what the Qualia Nagawa? The Qualia will make a quack when you go one of that another. He bought a room when Kachinek to take you. Now, Brebelang,
Mrs. Blessing Adimuntu in Umueri gave birth to twin baby girl and boy.
Now, no young will end up bump as a little silver. asị ka mụọ nwa n'ụlọ ọgwụ na free. Na-anara anyị ego mgbe m na-eje antenatal anakwuru anyị ego. Amụsịrị m nwa asị m na ba na nke weziere ego abụba orire nwa. Onye bụ ihe obi aṅụrị ji akpala m na anara m ego.
Those money that you're supposed to use to pay for the hospital and all those drugs, what did you use them for?
Anyị ji gosili akwa.
Wow, beautiful.
Gosili akwa. Welie gbukwu ọkụkụ ndị ngwụrụ ebe wee lie nri.
Eji m ego je ntu na ọka njere ana ka mmadụ m ibe na-ekwu nzi okwu maka na ndị be anyị na-atụ uri na-asị na osi ibele makela adị ibele ebe n'ọsụsị m naba na mmanụ ribe Soludo kwuru ma na-egoro redio ọ dị m surprise mgbe a na-atụ eli election o kwuru okwu na ibe niile ya adị na mma na Anambra m na-achọ n'okwu ndị election ọwa chiva nnọọ bụkwa disente ife abụọ kwuru na-eme so osisi Soludo amaka ọ mụrụ nwa witi anaghị ego ọbụla n'ụlọ ọgwụ ọgbụ dị na Mmụeri ihe ego anwa baara m uru rie nne uru ọba m na-eji nye tụọ mmụ aka m were nyebe nri egbukwuru m ọkụkọ bikọs onye mụrụ ejima bụ ihe ọṅụ ka ọ bụ so ọ tọrọ m ụtọ rinne ọchịchị anyị ọ ya na-asị na-aga ya bido na-asị na-aga ọ ya etinye ezie.
Okay. Anambra Blessing also gave birth to twin boys at the Primary Health Care Center Umueri, courtesy of Governor Soludo's free antenatal care and delivery services.
Nwere Ghana le mode abuna uko ndi ma abun na romu bam jebe na health center. Health center luwe ba abun no so na nene siem ar umno kumeka ndo. Yes. Ogazia treat them them treatment. Make them treatment in one young. So that's the nona Ojima can move Ojima. On our Janu no name time. Mumma no not person come miss where never. You could miss where you shoot. Oh, come as a quality tent. Una only echoing where or Jawalakia when you are.
That's mosquito treated net, yeah.
Where some of the family are air power. Okay. The water. Oh, for what do I get me to for them Casamaro and a local or no what I'm seeing for an order. Or the army to see about an next or with a bog or never. Or with a go there or put them never. Because people will make it away. Okay. Even in our no make the banner of family good. It was some river Van Allen. Tomorrow, one of them were there, Yavaga. On our dead, not that more, make that yard, or the Obavog, or Baspavog, or Nava. Governor Anambra State, an American, cannot try. Oh, the Owen, can I so no way, on any line actor, not to be a good year. You could go to Nachuku Kamua, ye goes in Yama, ye goes Governor Anambra State. Buzi kwa unwa bụkwa ndị na-ejelive ozi wee na-ekwu na asị na nke ome ma Chukwu ya enye promotion nye ogologo ndụ na arụ isi ike ya na ezinụlọ ya n'ụnwa bụkwa ndị na-ejeli ozi onyekwu na ogologo ndụ na arụ isi ike na ezinụlọ unu nyekwu promotion.
Uchechi Obinna said she just delivered her 5th baby.
A na-enete mmadụ anya ọfụma, number 1. Number 2, I na-amụ nwa free, ọgwụ antenatal free, mmụchakwa nwa free, adịghị akwụ ụgwọ, nwere ihe ọbụla a ga-anaghị ikulu nwa ya nawa. Ma ndị nọọsụ anyị na-enwe obi ọcha n'ebe ndị mmadụ nọ. Adịghị atakalị mmadụ ma mmadụ n'ime na-eme mmadụ kama a ga na-epenti ya epenti. Anyị soro ihe nji wela ife maternity a si na Soludo ga ọ dị anyị mma na-achịlị gawa na-ajụje ka o ji gosi onye asị na-ajụje ka o ji ihe dị mma na-ajụje ka o ji na aka ọrụ ya dị mma.
Nnemena Juliana is the officer in charge of Primary Healthcare Center Umuawolo.
We do announcements of free antenatal and free delivery, and they are personalizing that services. There are many that have already delivered here. Many have done their ANC here and delivered here also. Many are in their now and are in their antenatal services. They are never give birth to a child. So we are trying our best here. So we are thanking our governor, Governor Soludo, because what try since all but one na sita, here dị na all the facilities, including here, especially here, because here all like that. Really they design many things, bushes, but all try therefore tie like this place. Even renovate some of the buildings here. So I like any ring na mbo na agba na facility na nete ndị dị ime. Na netekwa ndị mụ gokwala amụ onye mmụọ nwa a na-enye onwe gift a na-enye. So ọ na-try anyị na-asị ka Chineke gozikwa anyị ka o mere na-aga.
Soludo try for me, oh. Even the day of Antenatal, they give me drugs well. As in any drug that I need, that is needed for pregnant women, he provided it for us. Even the day of delivery, I got free pad, free soap for my baby. The day I treated malaria, I treat it here and with enough drugs. As you can see, my baby is very healthy and sound. That is the evidence of the drugs that I took during the antenatal time. Because if any drugs that I required, the need will give it to me. If you deliver finish, you carry your baby and go home without anybody asking you for money. As you can see, my baby is very healthy because he provides all the drugs we need. May God bless him abundantly. Long life.
Uzoma Abum is a mother who recently gave birth to twins through cesarean section at Enugu General Hospital. She was delivered of her babies free of cost.
I did free antenatal at Umodioka Health Center. Is where I'm doing antenatal. So on the process, that was last week, Tuesday. So the matron from Umodioka Health Center called me on phone to say I should come and meet her at Umodioka Health Center. So I went there. She said that government has bandaged every health center to deliver twins. That she's going to refer me to General Hospital in Enugu. So she said I should come on Wednesday. So I went to Umodioka Health Center on Wednesday. So that's Wednesday in the morning. She gave me a referring letter to Enugu General Hospital. And to God be the glory, that Wednesday is the day Enugu is doing their antenatal day. So I went there, I met doctor and the matrons. They treated me very well. They did not collect any 1 naira from me. So they say I should go to scan for them to know how the baby is for that Enugu General Hospital. So I went to the scan there. So it's there that I noticed that I carried twins. And the first one is line breech, which I cannot give a birth to that. And the other one used egg. So she said, the doctor said that I will not use self-deriving, that I should use CS. So the doctor treated me very well. So I went home that Wednesday. So he said that the operation, he's going to book operation for me on Thursday. So on Friday. So that on Thursday in the morning, around 8 o'clock, I wake up. So I was sleeping. So after sleeping, I wake up. He called me on phone. He said that I have emergency. I should rush to Enugu General Hospital. That he has emergency. That is being serious after that one going to do my own. So I said, okay, no problem. I was rushing in short, that day, glory be to God, that Enugu General Hospital, they treated me very well. We did the CS, and they did not collect any 1 naira. Soludo is the best governor I never see. In short, in my next word, he will still be the governor. At least, he is trying in free delivery and free education. So, at least from his section now, he's doing well. I'm happy for that, and I'm praying that God will continue guide Soludo, and he will be the next another governor of Anambra State.
My brother, I feel happy because the way Nigeria is now, this is the best. This is what Nigeria needs, and I thank God that I benefit from the Governor Soludo. Both everything, both in free education. I really appreciate. I say, Governor Soludo, thank you. Thank you for all the things you are doing for Anambra State, for the poor people. Thank God today that I'm a part of it. I'm from another state, but I benefit from Anambra State. If you come out as a president in Nigeria, I will vote for you. And you remain. This time, nobody is contesting with you. You are number one in everything. You help the poor ones.
In conclusion, the implementation of free antenatal care and delivery services by the administration of Governor Chukwuma Charles Soludo is a landmark move that has directly impacted the lives of Anambra women and children, as well as drastically reduced child mortality rate in the state. He has today earned the popular name as the Governor of the Poor. Bringing joy and relief to expectant mothers, Governor Soludo's free antenatal care and delivery services in Anambra State is a game changer. This initiative ensures a safer, healthier start for generations to come. And that's it on this week's edition of Solution Footprints. Join us next week as we explore how more people now access government-owned health facilities in the state as a result of Governor Soludo's intervention and upgrade in the health sector. Follow us on our social media handles as Solution Footprints on Facebook, YouTube, TikTok, and Instagram, and Solution FP on X, formerly Twitter. My name is Chidimma Orangwa.
With our sweat and blood, every breath of our lives, we've trust in God.